Hi, how are you?
I'm doing good.
That's good. My name is Angela, and I'm going to be a nurse today. What I'm going to be doing is I'm going to do a head to toe assessment on you. Um, and what I'm going to do first is I'm going to check your head. I'm going to be looking for different things in your body, and I'm going to be inspecting. Okay?
Mm-hmm.
Could you do you mind introducing? Tell me your first name, last name, date of birth.
Dwayne Johnson, 11/22/06.
All right. And do you know why you're here today?
Physics.
All right. Do you know where you're at?
Um, the hospital.
And do you know what today's date is?
September 18th.
All right, thank you. So first I'm going to be doing is a general survey. And I'm going to be looking to make sure your posture is great. You're giving me eye contact. Everything is nice and even and symmetrical. And you're not in distress. And so I'm going to start with feeling your head to make sure there's no bumps or indentations. And I'm going to be looking through it to see if there's any sores or the abscess. Is that okay?
Okay.
Absolutely. Thank you. So what I'm doing now, I'm checking your head for any sores, abscess, indentations, which I don't see yet. It's great. Next, what I'm going to do is I'm going to palpate you since I'm right here messing with your head. I'm going to palpate to check for any pain, sinuses. Does this hurt?
No.
All right. Next, I'm going to do is I'm going to check your lymph nodes since I'm here. And this is your pre, your post, your occipital, your mandibular, your submental, your subclavicular. Now once I do that, I am just going to do, since I'm up here, your pulses, I'm going to check your temporal pulses. Make sure they're nice and strong and equal, which they are. I'm going to check your carotid pulse. Nice and strong and equal. Nice and strong and equal. Alrighty, so after I do that, I'm going to do the, after I do that, I am going to do the eye test on you. Okay. Sorry about that. So after I get done that, I'm going to do the eye test on you. And I'm going to make sure both eyebrows are symmetrical. I'm looking to see, checking your face to make sure there's no signs of a stroke. And I'm going to do a face check test on you. Is that okay?
Okay.
All right, I'm going to have you basically puff out your cheeks. I'm going to have you smile, frown, stick your tongue side to side. And I'm going to have you raise your eyebrows. Okay, I'm going to have you kind of close your eyebrows, raise them up. Perfect. Good job. And then what I'm also going to do is I'm going to do your eye test. And what I'm going to have you do is I'm going to have you stare straight at me. And I'm going to have you look at the light. And what I'm doing is make sure your eyes are nice and round and equal and reactive to light, which they are, so that means that they're consensual. The next thing I'm going to have you do is stare straight at this light for a second. Then I'm going to have you look at the square. Do you mind looking at the square? That means your eyes are accommodating, so that's perfect. Since I'm here, I'm going to do an ear test on you. I'm going to take your ear pods out. Thank you very much. Put them right there, and I'm going to pull back and look into your ear. I'm checking to see if there's any wax or anything. Just look nice and clean. Same thing again. I'm gonna look up, pull up, and pull back. Nice and clean. I'm gonna have you look inside your nostrils and make sure there's no any nasal congestions or any blood. Could you mind putting your head back? Perfect. Your nasals are a little swollen. I'm gonna see a little blood back there. Reach out to your doctors. But I do see that the next thing I'm gonna have you do is stick out your tongue and say ah. And what I'm doing is checking your uvula. Ah. Alrighty, perfect. You can close your mouth. We're gonna do it again, but this time you don't have to do ow. And what I'm doing, I'm checking the root of your tongue, the sides, I'm checking up top, making sure there's no abscesses or lesions, anything like that in your mouth, which looks perfect. Good job. So the next one I'm going to do is I'm going to have you press up against me, press up, go down. I'm going to also have you fold your hands like this, pull back, press away, push away. Perfect. I'm just going to check your capillary refill. Put for 3 seconds. Perfect. Looks nice and clear. And I'm going to have you put your legs straight. And what I'm doing is going to do a skin test on you. Make sure I don't see any. Check for arthritis, any edema in the legs. Want to make sure we have no edema. Checking your pedal pulses as well down here. Make sure no edema, no arthritis. I'm going to have you put your legs up, like press up, press up. Press the other one up. Press up with your feet, pull back, push back. Any pain when I do that? Nothing? Alrighty. Alright. So next thing I'm going to do is I am going to check for, and also another thing I was doing when I was down there, I was checking to see if there was any swelling or any DVT or arterial collusions in the legs, which I didn't see any of that in your legs at all. Next I'm going to do is I'm going to do a quick neural test on you. Do you know what this says?
Angela Teasley, driver's license.
All right. Do you know the date of birth?
01/15/1986.
Perfect. Thank you. And what I want to do now is the cardiac. I'm going to have you sit up. No, sit. And what I'm going to check for now is your first. This is your first intercostal, which is your aorta. Then you have your second is your pulmonic. Then you want to go down to the third one, which is your tricuspid. Then you have your midclavicular, and then you have your apical. I'm going to check it with the diaphragm. I'm going to check for a minute. I'm going to check for a minute. I'm going to have a watch usually to check that as well. And then also I'm doing is I'm listening, and I want to make sure that I'm inspecting. And when I'm inspecting the chest, I'm checking for any pacemakers, any type of surgeries, vasectomies, any type of surgeries to the chest. Once I check it with the diaphragm, I then turn around and I'm checking it with the bell to check for any abnormalities. Same thing. Some people go up. I usually start from here. I'm going to have you breathe in and out. Now I'm going to have you lean up again. And what I'm going to do is also check, have you turn around. Turn to the side this way, yes. And what I'm doing is I'm inspecting, I'm inspecting first. Sit up. I'm inspecting first, making sure I don't see any type of bruises, scars, making sure shoulders are equal. Everything is even, which I see that. I'm checking, I'm palpating right now for any pain, any discomfort when I do that. No? All right, perfect. So what I'm going to have you do is I'm going to have you fold your hands like you're giving yourself a big bear hug. Awesome. And what I do, then I'm going to again check the spine, and the scapula. And when I do the scapula, I'm going to go to the scapula, and then I'm going to work my way to the sides for the side and the spine. Breathe in. Perfect. Thank you. That's great. Now what I'm going to have you do is I'm going to have you lay down. Sorry, I had to cut the air on. It's a little hot in here. So what I'm going to have you do is I'm going to have you lay down. I'm going to check your abdominal. Sorry, I said abdominal. Your abdominal. And when I'm checking for it, I'm looking for any distension in there. I want to make sure you didn't have a hernia, any type of cuts, scars, C-section, things like that. And what I'm doing is I'm checking your distension. And if I do see a difference, I would want to measure it, measure the girth, and I want to measure your girth, and that is your your umbilical cords, not umbilicus. I'm sorry. I want to take, if I do see any distension, I want to measure, look side to side, and then measure it with the measuring tape, and I'm checking the girth and the umbilicus. So right now what I'm doing is I'm going to do an abdominal check, and I'm checking down here, which is the equiloval. I may be saying it wrong, but equiloval, which I'm going to check down here. Then up here is your equiloval, your appendix is down here. Up here is your liver. And on this side is your semicolon and your liver. Your gallbladder. I'm sorry. Your gallbladder. Once you check all that, once I'm doing all these checks, and I'm checking for the bowel movements as well, if I do not hear any bowel movements in any of the 4 quadrants, I'm going to listen for 5 minutes. And if I don't hear anything, I want to notify the doctor. After I listen to the bowel sounds, I would notify the doctor. Oh, another thing, I'm sorry. I would want to hear 5 to 35. If I don't, hypo is less than 5. Hyper is greater than 35. So right now what I'm going to do is I'm going to palpate, because you just went to the bathroom, so you shouldn't have any type of pain in your stomach. And I'm checking your abdominal. And I'm palpating. You feel any pain or discomfort when I do this? Alrighty. And when you go to the bathroom, do you have any issues with your urine? No? Okay. And do you see any type of blood in your urine? What color is your urine when you go to the bathroom? Is it yellow? Is it a clear color? Is it pale? Cloudy? Clear? Okay. Like water. Okay. And you can sit up for me 1 second. I also want to check your pulses. So right now what I'm doing is, hold your hands off of me. I am checking your brachial artery, your radial, your ulna, your popliteal, your pedal pulses, your temporal, your carotid. And all of these, they were round. They were regular, equal to each other, and they were definitely nice and strong. So right now we did the also evaluated you, the loss of consciousness. You were alert. Your words wasn't slurred. You was able to stand. You was able to do the assessment with no issues. So everything was good there. And another thing is when we're doing a balance test. If I'm doing a balance test on you, I want to stand next to the patient, have them put their arms side to side and make sure they're not swaying. Trying to think, did I forget anything? We checked your ears. Oh, I didn't do the whisper test on you. The whisper test. So what I'm going to do is, sir, I'm going to have you sit up, and then I'm going to check through your one ear, and you're going to cover your one ear, and you're just going to kind of tell me what I'm saying.
1, 2, 3.
Usually I will be behind the patient doing it, but because the couch is right here, I'm in front of the patient.
A, B, C.
Alrighty, thank you very much. I'm just trying to think and see, did I forget anything? No, we went over there, we did your pulses, did your level of consciousness, we checked your abdominal. I made sure there was no scars, any type of pacemakers. I checked the distension in your abdominal. I listened for the bowel movements for you. Did the eyes, they were round, equal, and reactive to light. I didn't do the capillary pulses in your feet. Refill your feet, which they are great. We did that. I didn't hold your hands, and they squeezed my hand for me. Perfect. And they're equal as well. I think that's it. That ends my assessment. And always make sure you wash your hands. Have a good day.